So the concept three-dimensionally of volume loss is one that's recent in our thought processes regarding cosmetic surgery. Patients will come to me and say, I need X, I need a facelift, or I need this. And what they don't realize is that when you're talking about lifting, you're talking about gravity. So there are changes that result because of gravity changes. And so we have the laxity of the collagen and the tissues sag. And so lifting procedures will lift that. But there's two other components. So you have gravity, you have volume, specifically volume loss, and you have textural changes. And when you're addressing aging, you really have to address globally those three things. So someone may have a little bit of gravity changes, but they've spent a lot of time in the sun and they have tremendous amount of textural changes. So treating the skin is more important than lifting the skin. And if you lift the skin, but it's the same old fabric and it shows tons of wrinkles, they'll still look aged. So you have to really analyze the patient from the perspective of gravity changes, volume loss, and textural changes. Volume loss is something that 10 years ago, no one spoke about. And truly, that's added the third dimension to aging treatments that we do. So now, fat grafting is so popular. We have, more than a dozen fillers that are used to revolumize the face. Surgical procedures are all geared towards either volume preservation or volume enhancement. And so I think that when I look at my best outcomes, I address the patient for what was appropriate for their aging. Some patients need help in all three areas, whereas others, one area, they may have skin that has not a single wrinkle, but is sagging. And so there, where you do a lifting procedure, it's like hitting a home run. Other patients need volume more than they need lifting. And if you do lifting, it's like lifting an empty envelope and there is no fill to it. And so that doesn't necessarily look better. So, I come back to this philosophy I have, which is when I look at aging, it's to look at it globally and address specifically what part of those three elements is really missing.